Welcome, everyone. Saludos, and thank you for joining us today for Wellness Wednesdays, our second community engagement in research webinar being hosted by the Juan Antonio Corregel Puerto Rican Cultural Center of Chicago. Developed resources reported in this webinar are supported by the network of the National Library of Medicine, the National Institute of Health, NIH, under the cooperative agreement. The content is the sole responsibility of the authors and does not necessarily represent the official views of the NIH. The sessions throughout this series will provide health education information and resources. Today's webinar discusses culturally responsive strategies for engaging the Latinx LGBTQIA+ community in research. We will hear from co-founder and executive director Jose Lopez about how the Puerto Rican Cultural Center has been instrumental in addressing inequities experienced by the LGBTQIA+ community. We're also joined by Dr. Omar Martinez Folledo from Temple University, who will discuss evidence-based intervention in HIV prevention and care for Latinx sexual and gender minorities. Bienvenidos, mi gente. My name is Lisa Ponte Soto. I'm the founding president and CEO of Tanoma Consulting, the moderator of this webinar series. I'm a health inequities researcher and evaluator trained in public health community participatory, culturally, and linguistically appropriate practices. Tanoma Consulting is a national nonprofit consulting firm providing transformative, culturally responsive research, evaluation, and training services to advance health, education, and workforce equity. For more information, you can visit us online at www.tanomaconsulting.com. Before we begin, we want to quickly introduce you to our team members. Xiomara Rodriguez, Director of Digital Presence Initiative at the Puerto Rican Cultural Center. Zenaida Lopez, Associate Director of El Rescate Transitional Living Program, that you'll learn a little bit more about in a few moments at the Puerto Rican Cultural Center. Emily Medina Rodriguez, Research Associate at the Puerto Rican Cultural Center and Associate at Tanoma Consulting on this project, and also Kimberly Silva, Research Associate with Tanoma Consulting. I want to also introduce you and acknowledge our liaisons, Dr. Aida Giacello, Professor at Northwestern University's Feinberg School of Preventative Medicine, Susana Gonzalez, Nurse Consultant and Educator at ASI Home Care, and a member of the Illinois chapters of the National Association of Hispanic Nurses, and also Monica Rodriguez, Director of Community Communications and Engagement at All of Us at the Northwestern University. We also want to acknowledge a couple of members that weren't highlighted on our previous slide. Ms. Melissa Banerjee at the Puerto Rican Cultural Center. She is Director of Development, and also Dr. Will Cobbs, Director of Evaluation at the Puerto Rican Cultural Center. We'd also like to acknowledge our partners for this webinar series, the Illinois Precision Medicine Consortium for the All of Us Project, comprised of 6 Chicago-based medical centers, the Puerto Rican Agenda of Chicago, a nonprofit organization comprised of local Puerto Rican leaders ensuring the self-determination of Puerto Ricans in Chicago, throughout the diaspora, and in Puerto Rico through policy and advocacy. El Rescate and Vidacida, 2 programs of the Puerto Rican Cultural Center that you'll learn more about in just a few minutes. The Illinois chapter of the National Hispanic Nurses Association, a professional, voluntary, and nonprofit healthcare organization dedicated to enriching the lives of Hispanic nurse individuals through the promotion of academic attainment, mentorship, professional development, and actively reshaping healthcare in the Hispanic community. And lastly, Illinois Unidos, a consortium of Latino clinicians, elected officials, public health practitioners, educators, and community organizers addressing inequities due to the impact of COVID-19 in the Latino communities and beyond. Before we begin, we want to know who is presente with us today. So please announce yourselves in the chat. Put your name, what organization you're from, and what city or neighborhood you represent, or maybe it's a state. Just tell us where you're from. And as we continue our programming for today, please note that we will leave a few minutes at the end of the session for Q&A. So make sure that you enter any questions or comments that you have in the chat throughout the session. Also, you can follow our conversation on Facebook Live as we're currently live streaming at www.facebook.com/prcc.chicago. And if you're following the conversation on Twitter, please use the hashtags all of us research, PRCC-Chicago, LGBTQIA+, or tag us at JACPRCC, at all of us research, at Tanoma LLC, or at Latino Activist. And now I would like to introduce Darlene Caskey, who is our funding agent and community engagement coordinator for the Greater Midwest region of the network of the National Library of Medicine. Darlene?
Thank you for having me. And on behalf of the network, I'm honored to partner with the Puerto Rican Cultural Center to bring trusted, meaningful health information to you. And if you're wondering who we are, the Network of the National Library of Medicine is an ecosystem of 8 regional medical libraries and more than 9,000 organizations across the United States that support health information and outreach for the National Library of Medicine. So you might be asking, what is the National Library of Medicine? Next slide, please. The National Library of Medicine is one of the 27 National Institutes of Health located on the NIH campus in Bethesda, Maryland. It's also the world's largest biomedical library, offering a vast print collection as well as electronic resources to researchers, health professionals, and the general public.
Here is the National Library of Medicine's consumer health and wellness website called Medline Plus. It's free online health information in English and Spanish. It's current, easy to use, and trustworthy because it is developed by professionals at the National Library of Medicine. Also, Medline Plus receives no advertising dollars, unlike WebMD or Google. Did you know that a Google search for cancer results in more than 952 million hits? Instead of relying on a paid search engine, you can go directly to a health topic using Medline Plus. In 2017, the National Library of Medicine received an award from the NIH All of Us Research Program. And with this award, the NNLM All of Us Community Engagement Network was formed. NNLM All of Us has 2 priorities. One is to continue doing what we have always done, improve access to health information. For example, we awarded 6 Chicago public libraries, including the Humboldt Park branch, with an iPad and stand. The kiosk is set up to go directly to Medline Plus and other health literacy learning tools. And second, we support the NIH mission to advance medicine by raising awareness of the All of Us research program. For example, we purchased consumer health books for 250 rural and small libraries, and each book came with an All of Us sticker attached. And by funding partners like the Puerto Rican Cultural Center, together we can support the health information needs that are relevant to your community and raise awareness of the importance of medical research to you and to your loved ones. So thank you for attending today's webinar. And if you would like to learn more about NNLM All of Us and the ways you or your organization can participate, learn, and work with us, please visit our website at nnlm.gov/allofus.
Wonderful. Thank you so much, Darlene. We want to remind everyone to please complete the post-event survey after today's session. And you'll have that available in the chat. Next, we are incredibly honored to hear from co-founder and executive director of the Juan Antonio Corregel Puerto Rican Cultural Center of Chicago, Mr. Jose Lopez. Jose was born in 1949 in San Sebastián, Puerto Rico. In 1959, his family moved to Chicago as part of the massive Puerto Rican migration to the United States. He has written extensively on the political and social reality of Puerto Ricans in the United States while serving as executive director of the Puerto Rican Cultural Center, Juan Antonio Corregel in Chicago, which he co-founded in 1973. He is also an adjunct instructor at Northeastern Illinois University, Columbia College, and the University of Illinois at Chicago. In his role as educator advocate, activist, he has been invited to speak at over 50 colleges and universities in the United States, Mexico, Canada, and Puerto Rico, as well as in international forums such as the United Nations Decolonization Committee. For over 40 years, he's been a leading member of the Puerto Rican independence movement and is also the editor of Puerto Rican Nationalism, a reader. Presently, he is active in developing new praxis theory in community and social empowerment, particularly in the areas of educational reform through the Community as Campus initiative and addressing health inequities through building of a holistic community of wellness in Chicago's greater Humboldt Park communities. He has served on various boards, including the Bethany Advocate Fund Board and presently on the Chicago Public Schools Latino Advisory Committee. Over the years, he has received many recognitions, including the Cook County Board of Commissioners 2009 Hispanic Heritage Award, the 2010 Health Award from the Health and Medicine Policy Research Group, and the Chicago Cultural Alliance 2014 Outstanding Community Leader Award. Muchísimas gracias, Jose. What an honor to see how the Puerto Rican Center has poised itself to really serve the community. So we now invite you to share some remarks.
So thank you for that introduction. I am really happy to participate in this incredible discussion. I want to frame our work within the context of many years of having had the challenge to serve the most marginalized, the most perhaps the people that no one wants. And we began with a project in 1972, which was a school that we built as an alternative school for dropouts. And we continue to do a lot of work with those in our community who are the most disempowered and in most ways marginalized. In terms of our commitment to the LGBTQ community, I think the work of the Puerto Rican Cultural Center speaks to an organically driven, holistic approach to addressing social issues in communities of color. We began to really look deeply into the situation that we were facing in the 1980s as a community, as hundreds of our residents were dying from AIDS. We ended up ultimately through the work of an amazing epidemiologist, Dr. Steve Whitman, to conclude that Puerto Ricans at the highest rate, actually was at the highest level of AIDS in the city of Chicago, or being impacted by AIDS. And so in 1988, we created an initiative to address AIDS in our community, but also to take on the stigma of homophobia. And as you notice, the name of our project is called Vida Sida. And people told us we were crazy. How could we put out an initiative so open on something that was so controversial? And we said, we as a community must assume full responsibility for the people in our community that live and have died from AIDS. Vida Sida. Live, obviously, vida, life, Sida, AIDS. And so it is in that context that we began our work to address this incredible disease that impacted our community so negatively and it created so much fear, but also that fear was driven by the stigma of homophobia in our community, as well as in the broader society in Chicago and in the United States. And so at that moment, we said we were not going to accept that the people that were dying from AIDS in our community were to be isolated, that those who died from AIDS, often their caskets were closed because people were afraid to talk about someone dying from AIDS. But at the same time, they were revealing it by making sure that the caskets were closed. This is something that went against the very idea of how Puerto Ricans and Latino view the very concept of death itself. And so we were challenged to take this on and to work with people living with HIV, AIDS, and families whose family members had died from AIDS to create this initiative in 1998. And we're probably the oldest, most consistent, most vibrant community-driven initiative addressing AIDS probably in the United States. And we did that at the same time we addressed AIDS. We wanted to make sure that we address homophobia. And we had to deal with the fact that there's a lot of issues about human sexuality in our community. And we began to really organize our work around the idea that human sexuality is the most human of human expressions. Therefore, there is nothing natural or unnatural about sexual expressions. That people can choose whatever sexual expressions they want, and it is their choice, and we need to respect it. And that for us was extremely important. And so after that, we've created a whole series of initiatives that has included El Rescate Transitional Living Program for young and homeless LGBTQ youth in our community. We have had a whole series of initiatives under the Trans Chicago Empowerment, now named after one of our most important personalities in our community, that is a living legend for transgender leadership, Lisa Isadora Cruz. And we offer all kinds of services to the trans community, for everything from obviously wellness initiative, mental wellness programs, but we also even provide places to make sure that their skills and their talents are valued and are turned into entrepreneurial enterprises through our business incubators, etc. We have a community prevention mobile unit named after one of our heroic members of our community, Ricardo Jimenez, that provides services in the communities, taking it to people's, to the smallest units in our community to provide that medical services, testing, all of those things. And we have undertaken a whole process that encourages young people and old people to feel good and to be part of our community as they express themselves in the variety of sexual expressions that we as human beings can express. And so for us, particularly to provide role models. So for many years, the queen of our parade, probably the only ethnic parade in the United States in which the queen, and we call her a cacica, is a transgender woman, in which there is a process of selection that honors and dignifies the transgender in our community. We have obviously created a very welcoming LGBTQ presence everywhere. And our young people can feel safe, they can feel secure, they can feel that we are a place that is safe and inviting, where they can explore their sexuality, make sure that they could also do it in a way that is ultimately ethically driven. And so for us, the idea of taking on gender against trans people, against LGBTQ people, have been a part of all of many, much of our work in exposing any act of violence against any member of the LGBTQ community. And you can go all around Paseo Boricua. You can participate in all of our events. And the pride and the joy and the spirit that young LGBTQ people express in our community, you will find it probably nowhere else in the United States. So we are extremely proud of the work we have done. We have made sure that many of the people who are employed in our program are LGBTQ, and particularly we make sure that we are servicing the transgender community as in the area of employment, because they're one of the most marginalized groups in our community. I think that the work that we have done in the Puerto Rican Cultural Center in addressing the issues that confront LGBTQ is really a model to be emulated. And it's a model, obviously, that calls upon many people to be able to have the courage to be, and to be able to have the courage to understand that ultimately what makes us uniquely human is our differences. As a matter of fact, there's a wonderful quote from the Quran, the holy book of Islam, that states, "We have made you different so you can know each other. We have made you different so you can know each other." What an amazing concept of our human identity, that it is in our differences that we can really find our human identity, not in our sameness, not in insisting that everyone be the same, but in insisting that everyone can have the joy, the happiness of expressing who they are without having to live in fear, without having to be silenced, and without having to become the invisible human beings. That's what informs our work, and that's what makes our work so unique. I obviously encourage people, and particularly our listeners, to participate and get involved in the work of the Puerto Rican Cultural Center. You can follow us on our Facebook page at the Puerto Rican Cultural Center and on Instagram. Thank you very much.
Muchísimas gracias, Jose. Again, what an honor, again, to see how the Puerto Rican Cultural Center has really poised itself to be sort of at the forefront of driving community change and responding to the needs of the community, particularly the LGBTQIA community, a community that has been historically marginalized, echoing the importance of making sure that the community, the LGBTQIA community in particular, has a space to feel secure and loved. We'll now move on to our next speaker. It's my esteemed pleasure to introduce Dr. Omar Martinez Folledo, Associate Professor at Temple University School of Social Work. At Temple University, Dr. Martinez Folledo leads the Implementation Sciences Laboratory. His research integrates perspectives from public health, medicine, law, social work, and human sexuality to create interdisciplinary strategies that address health disparities among sexual and gender minorities in the US and abroad. His experiences include the design, implementation, and evaluation of programs and interventions to address the health disparities affecting underserved populations, including the Trans Equity Research Project, a peer-led group-based HIV prevention and care prevention intervention for men and women of trans experience. Hombres, a best evidence community level HIV prevention intervention for self-identified heterosexual Latinx, Connect and Unite, a couple-based behavioral HIV prevention intervention for Black men who have sex with men, and Connecting Latinx in Parejas, a couple-based HIV prevention and care intervention for Latinx men who have sex with men. Dr. Martinez is currently leading an NIH-funded study that is developing a medical legal partnership comprehensive HIV care diffusion model to improve the HIV care continuum outcomes among people living with HIV. Dr. Martinez is also committed to training the next generation of behavioral researchers. He currently serves as a consultant to the HIV Intervention Science Training Program for underrepresented new investigators at Columbia University. Welcome, Dr. Martinez. We are honored to have you here today.
Excellent. Thank you for the introduction, and thank you for having me. I'm honored and humble to be here today, especially sharing this space, this sacred space, and this conversation with Jose Lopez, a prominent leader in our community and someone that today I got the opportunity to learn more about his work and his vision with the center. So thank you again for this opportunity. So this is what I have for today. Let's get it going. I promise that I'm going to get you through this agenda in 20 minutes. First, I'm going to highlight my work on HIV and particularly HIV among sexual and gender minorities, Latinos and Latinas, my work on syndemics, immigration and stigma. And then I'm going to walk you through three federally funded studies, mainly on HIV prevention and care for Latinos and sexual and gender minorities. The first one is Connecting Latinos en Pareja. It's a couples-based HIV prevention intervention for Latino male couples. The second project is looking at medical legal partnerships and its impact on the HIV care continuum. And then we're going to wrap it up with Trans Equity Research Project, a homegrown intervention to address disparities in HIV among men and women of trans experience. We're going to wrap it up with a few discussion points and future directions. Our work with syndemics. So this is a study that we conducted with behaviorally bisexual Latino men in New York City. Here's some of the demographics and some of the characteristics of the sample. Over 1/3 reported polydrug use, nearly 1/4, 22% reported childhood sexual abuse. Over half of the sample reported high stress. Participants with 2 or 3 factors were significantly more likely to be diagnosed with an STIs, and participants with 2 or more syndemic factors were over 7 times more likely to report condomless intercourse than those with 0 conditions. So clearly, the dose matters, right? The number of syndemic conditions matters when we look at HIV prevention and care. This is a study that we recently completed with a large sample of Latino men who had sex with men here in Philadelphia, predominantly Philly Ricans. And here's a snapshot of that sample. So syndemic factors, heavy drinking, sex work, and homophobic discrimination. In multivariable syndemic analysis, participants with 2 or more factors reported more male partners and more condomless intercourse with casual partners than those with nuns. Once again, adding the value of syndemics research, adding to the value of syndemic works, and really looking at these factors and these endemic conditions and how they contribute to the HIV epidemic. On immigration, and this is something that I'm really, really proud of our team, we have built research that really has documented the detrimental impact of the intertwined process of immigration, health, and wellness. For sexual and gender minority immigrants, the anti-immigration rhetoric is often linked with HIV acquisition and transmission, delays in HIV prevention and treatment, substance use, negative mental health outcomes, and isolation. So we have proved that quantitatively and qualitatively. But as a researchers that love qualitative research, I'm bringing the voice of those in our communities. And here's one of them. Many people won't go and seek out services because they're afraid it will affect their immigration status. For fear of being found out as undocumented immigrants, they don't go and seek help, right? And this quote really illustrates the impact of immigration on care, on access to health among this population. On HIV-related stigma, 2 years ago, I published an article looking at stigma as a determinant, right, of health among sexual and gender minorities. HIV-related stigma includes negative attitudes and beliefs directed at people living with HIV and or associated with people living with HIV. It is the prejudice that comes with labeling an individual as part of a group that is believed to be socially unacceptable. So what are we doing? And the first project is Connecting Latinos en Parejas. It's a CDC-funded study that aims to assess the impact of a couples-based prevention intervention for Latino male couples. And important to note is that this is something that I'm really proud of. Through all the stages of the research projects, a community advisory board has guided the research process. In fact, right, when putting together this grant proposal, community members help us and challenge us with the research questions for that same proposals. So this is something that I'm really proud of, right? Community members has been guiding these research projects since the start of the process. And so community members, around 15 community advisory board members have guided, once again, all the stages of the research process. And here is the first sample of how it pays off, right? Community-based participatory action research works. As you can see, this is some of our recruitment flyers and materials, right? And one of the things that the community members highlighted, I mean, I was coming from New York. I did my postdoc at New York, and this project is here in Philadelphia. The idea of sex cells, right, in HIV prevention and research. And that community advisory board challenged me and say, hey, Cubanito, slow down, right? Let's actually stop the hypersexualization of Black and brown bodies in research. So that was a very humbling experience for me, and kudos to that community advisory board, right? That's the added value of community members in the research projects. So if you see, right, all of these men have shirts, right, are dressed, right, and are sharing something, are part of an experience that is loved, right? Whether it's raising a kid or whether it's hugging your partner. Another piece, right, is that this project is also inclusive of HIV zero status. So we're including both people living with HIV and Latinos that are not living with HIV. So that's, I just wanted to highlight that. And this is the end product of community engaged research process. A little bit more about the intervention itself. So it's once again, it's a 4-session peer-led intervention. There's session 1 talks about personal, cultural, and contextual influence on HIV risk. Session 2 addresses issues of communication at the dyads level. Session 3 talks about relationship strengthening for HIV protection. And session 4 is all about social support for HIV prevention and dealing with the sleeps. Here's some of the content of that manual that we developed. Another added value of that CAP is like, you know, when we think about HIV prevention, we need to think beyond condoms, right? So let's present the prevention toolkit, right? Like let's build a prevention toolkit. If condoms don't work for you, what about PrEP, right? If you're in a serodiscordant relationship, right? What about treatment as prevention? So we were thinking, and we put together a great video that I don't think we have time for today, but I'm happy to share with the audience on how we presented this prevention toolkit for our community members. Once again, the community advisory board also guided us in developing these case scenarios, right, that are responsive to the needs of Latino male couples, right? Tony and Alberto have been together for 2 years, right? Alberto suggests bringing a third, right? So this case study talks about negotiation, right? And how you bring a third into the relationship and how to negotiate condom use, right? So once again, we wanted to include real case studies, right? Real experiences that Latino male couples are faced with, right? And that's another kudos to that CAB. Here's some of the quotes from the participants that have completed the study, right? This program was extremely helpful in building and strengthening relationships. Be comfortable and always be prepared. Use the prevention toolkit. Connecting Latinos en Parejas has been an eye-opener for not only sex and health education, but for the many ways we can grow as a whole in community and relationships. The second project is looking at medical legal partnerships. We have been building this pipeline of research and work on MLPs. This is a study we published a few years ago, and where we established that MLPs offer structural integrated intervention that could facilitate improvement in medical and psychosocial outcomes among people living with HIV through legal aid, right? And that's core. Through legal aid and legal advocacy, MLPs can ensure that patients are able to access HIV services in a culturally sensitive way. Here are the specific aims. Once again, I'm going to be sharing that with you as well about this particular study funded by NIH. What is the added value of the attorney in the care team, right? The attorneys address health harming legal needs and risk, prevents issues from becoming legal needs, provide advice and guidance to that staff, right? So in addition to that patient support, you also have that team-facing support, right? And as we know, the added value of the attorney is also addressing this patient-facing legal needs through the Know Your Rights workshops, right? So it looks at that preventive approach to care and legal aid. Here are some of our preliminary findings. What we found is that within these medical legal partnerships nationwide, right, that serve people living with HIV, there's 3 continuums of care, right? So there's the HIV care continuum, there's the legal continuum of care, from detecting health harming legal needs to improving equitable access to care, but there's also the social service continuum of care. And this is an important takeaway, right? Because when we think about HIV care, we need to be thinking about other continuums of care, right? What about the social service continuum? What about the legal continuum of care to address and improve the lives of people living with HIV? As part of this study, we also package a training. So kudos to David Robinson, our research associate that developed these training manuals for those AIDS service organizations interested in actually establishing a medical legal partnerships. Session 1, we go over social and structural determinants of health. Session 2 addresses legal aid. Session 3, HIV care continuum. 4, health harming legal needs. 5, integration of legal services into the medical care team. Session 6, the prerequisites of a medical legal partnership. This one, we were pushing to establish Philadelphia MLPs. Still a work in progress. Session 7 is screening, how to screen for health harming legal needs. We developed a screening tool that I'm happy to share as well with the folks here today. The MLP in action, and Section 9 data collection. We put together a grant proposal. We barely missed it. We got it scored, and a good impact factor. And the grant is going to be reviewed tomorrow. So we've revised and resubmitted the proposal. So fingers crossed. And this particular one is going to be here in Philadelphia. So we're going to be able to test the impact of medical legal partnership on addressing HIV care continuance outcomes here in Philly. So fingers crossed. Last but not least is the Trans Equity Research Project. We wanted to develop an HIV prevention intervention for men and women of trans experience here in the city. How did we get there? And once again, the community members guided all the stages of the research project. Tatiana Wooder, Dejalene Alvarez, kudos to these community members and that were part of the research team that enabled this project. We engaged 20 community members. We also engaged a scientific advisory board, experts in implementation science, transgender care. We conducted in-depth interviews with peer navigators, so building from what is out there in the community. So we interviewed these peer navigators, these promotores that were serving this community. We also conducted a screening. We also collected quantitative data through a screening instrument and conducted focus group with these men and women of trans experience. Here's a snapshot of the characteristics of the sample. Very diverse in terms of race and ethnicity, in terms of gender identity. 3 of them were caring for children. 16 have reported homelessness in the past 3 months. We also wanted to capture, in addition to HIV, other comorbidities impacting men and women of trans experience, right? Asthma was really high, diabetes, right? Cancer, So cancer, none of them reported cancer, sorry. Psychiatric condition and mental health disorders, 27%, 27 of them, 71% of the sample. So beyond HIV, we wanted to understand the characteristics of this sample. We also capture experiences of discrimination. As you can see, is top down, a community highly impacted by stigma discrimination. And we wanted to make sure that we were able to capture that, as well as the reasons why they were discriminated, right? Based on gender, based on race and ethnicity, based on physical appearance, based on gender identity, right? So kudos to the CAP as well. We went through a refinement process of this experience of discrimination instrument. So we started with Nancy Krieger's, she's a Harvard experience of discrimination instrument, and then we took it to the CAP and they refined it, and here's the end product. We also conducted STI testing, and 4 out of 40 tested positive for STIs. And we inquire about how to make this more accessible to this community. And here are some of the quotes. Let's educate more about risk for STIs, make condom and STI self-testing more accessible to the community. The end product is a 3-group delivery intervention for men and women of trans experience. On the left side, session 1 addresses issues of self-care and comprehensive trans care. Session 2, communication and relationship building. And session 3, and I think Jose Lopez did a great job with this, highlighting the need for skills and job training for this population. And they wanted to see that in this intervention. So life skills and professional development, the need for more of that work, right, when working with this population. Wrapping it up, a few discussion points. Syndemics as a conceptual instrument has the potential to help policymakers and program implementers in their endeavors to improve population health. We need to improve our surveillance systems and survey instruments to make sure that we capture the social and structural drivers contributing to poor health outcomes among sexual and gender minorities. We need to do better, right? And surveillance systems often fail to capture gender identity. Examine immigration as a social determinant of health. Most of our work is behaviorally focused rather than investigating contextual drivers of behaviors and the possibility of that upstream change. Enhance the impact of implementation strategies under the leadership and vision of Carlos Rodriguez Diaz, a Puerto Rican associate professor at George Washington. We just published a paper at The Lancet looking at ending the HIV epidemic in US Latinx sexual and gender minorities. And we highlight the importance of implementation science, the significance of implementation science to address the HIV epidemic. We need to continue the investment of locally homegrown prevention, treatment, and programs. I sit on the board of GALE, one of the first, along with the Puerto Rican Cultural Centers, established in the 1980s under the leadership of David Acostas, and they have excellent programs, homegrown programs. So we need to continue the investment and development of homegrown, locally developed programs. They have a great initiative called Positivo to address HIV stigma. I also want to thank my partners, my mentors, my colleagues for their support to this line of research work. And thank you for your time. Thank you.
That was quite impressive. You did cover a lot of amazing and very important information, even emphasizing the importance of listening to community, because it's not just collaborating with community. We can choose not to, as researchers, listen to what they're telling us. And I think that's the important underlying message there, to listen as you're collaborating, to truly do it by listening and being actionable. But really, truly, on behalf of the Puerto Rican Cultural Center and the network of the National Library of Medicine and our partners, I want to thank Mr. Jose Lopez and Dr. Omar Martinez Folledo again for sharing their experiences and expertise working with gender and sexual minorities. We got to see a little glimpse of how both of you embody this work through community research, through a community researcher's perspective, right? That lens, as well as the activist lens. And we got to see how those lines blur as researchers engage in activism with community and partnership, and as activists engage in research, and how these worlds come together for a common cause to address inequities in partnership. So now we'll open for questions.
Yeah, I have one question from Dr. Cobbs, who would like to know who developed the questions to interview the peer navigators. And he also says, good luck on your proposal review.
Excellent question. So there's a lot of questioners here, right? The work on syndemics, we use NHBA's database here from Philadelphia, and that was developed by the Department of Health in collaboration with the CDC. So those were the questions for the syndemics analysis. The one for Latino MSM in New York City and the same syndemics analysis work, we use a combination of validated measures that were already validated with sexual minorities, but we also develop a few instruments. And once again, the processes, we have used both processes, right? One, when we have the English instrument that hasn't been validated with the Spanish-speaking population, and we do the Marin translation process, and I'm happy to share those articles with you for translation and back translation. And then we also, after that process, we bring back that translated and back translated scale to the community advisory board to provide feedback. Does this make sense, right? Does this work with Philly Ricans in New York City, right? Philly Ricans in Philadelphia, right? Or New Yorkers in New York. And then we get that process of feedback, but we do make annotations of the changes from the regional validated scale for tracking purposes. For the trans population, we use Nancy Krieger's original instrument, and then we brought it to the CAB, to these men and women of trans experience, and they provided feedback on the instrument. And I believe they added a few items on healthcare, right? Discrimination from healthcare providers. They added a few items on the police interaction, but they also added a bunch of categories related to the reasons why they were discriminated, including physical appearance, documentation status. So that's the added contribution from that CAP for that particular instrument. But I'm happy to share more through email, the processes that we do for translation and back translation, and the processes we do to also refine these instruments and make sure that they're culturally and linguistically appropriate with the communities that we're working with. Because once again, and this is really important, Latinos are not a monolithic group, right? And there's a wide variety and different characteristics, right? Migration patterns, pre and post-migration experiences that must be accounted when we build these instruments or when we validate these instruments. Excellent question.
So when you were actually going to the CAB with these validated instruments, you had to engage in another layer of validation as they added questions and categories, and that's the process that you're saying that you're willing to share, because I do agree. And I mean, of course, any researcher would, that local, cultural nuances can, greatly impact how we develop these surveys or these instruments. And so if you already have something that's been validated with, that kind of analysis, then you introduce it into a local community that has its own specific nuances. I was just wondering, does that?
No, and I think you nailed it. There has to be
another. Mm-hmm.
Yeah, no, and I think you nailed it. Unfortunately, because of funding, as you know, the validation of instruments take time, right? Takes a sample size, a power sample size.
Right.
And for this particular project, we couldn't do that validation of that instrument, the Nancy Krieger one. So we couldn't get there. So for future research, right, that could be the next step, right? Validating this adapted and refined instrument that resulted from this formative work with 40 men and women of trans experience. But you're correct. After that process of translation and back translation and feedback from the community members, there's another process of validation, right? Validating that refined instrument for that new population. Because of funding, this was a $10,000 pilot project, formative work with 40 men and women of training experience. We didn't have the sample size to first validate it and then take it into the research process. Is that clear? I just want to make sure.
Yes, yes. Thank you very much. And this is very interesting work, and I'm very grateful for your time today. Thank you.
Thank you. That's it. Next question.
Okay, this one's from Dr. Giatello. She says that some of her research among LGBTQ plus using focus groups has found that trans community has the worst health status, depression, suicidal attempts, substance abuse, etc. And some of your findings are also consistent with that. Do you think you can elaborate why the transgender community has worse health outcomes?
Well, before we go into the research piece, I would love to bring in Jose Lopez. I mean, and folks from the Puerto Rican cultural centers. They work directly daily with these communities. And I know Jose Lopez did a great job highlighting some of these microaggressions, the constant aggression, the transphobia that these folks live daily, including getting beaten up on the street. Right, and not saying all of them, right, and that's important to highlight, but a substantial number of that population live on the constant threat. I mean, you saw the hearing of Levine from Ron Paul, right? Like I get tear up. That those constant microaggressions that trans folks live daily, right? And we all saw it, how this cis white man ingrained his prejudice, right? His hate. To target trans women, right? And that's a perfect example, right? If you're a trans kid out there, if you're a trans woman, a trans man, seeing this, just put yourself in those shoes and then link it together to mental health, right? Like, anyhow, but Jose Lopez, do you have anything to add on that?
Well, you did a wonderful presentation, and I have to congratulate you. I think that for us on the ground here, I believe that context, and you made that over and over, we have to contextualize everything. We exist as an ecosystem. And in this ecosystem, there's so many intersectionalities. And one of the things that community building must inform is that idea of intersectionality. So when we have that kind of violence, when we have that kind of rejection, there has to be an important element that organizations and communities must undertake, almost as being there to guarantee that these sexual expressions are respected and dignified, and that they are part not only of our present history, they have been a part of our entire history. And I just want to say in that context, because I'm a historian, I just want to say that one of the things that we haven't studied as Latino is really deeply study our origins in the Maroon societies. Maroon societies were amazing communities of resistance in which multiple sexual expressions were permitted and were allowed. And I think that's something that we have to look at in terms of our historical process, in terms of our historical process of meaning and identity as communities. And so I would like to invite the listeners to begin to study Maroon societies and study them from the vantage point also of this kind of not tolerance, but acceptance. Acceptance means that we accept diversity, we accept differences, and we welcome them, and we're part of a defense mechanism that will ensure a community of wellness in which people are not beaten and violence is committed against them.
Thank you so much. Unfortunately, thank you both, Jose and Dr. Martinez. Unfortunately, we don't have any more time for questions right now, but because we do want to share some resources, and it's really important for us to be able to share hopefully some resources that those of you who are joining us today will find useful and valuable as we continue this conversation. So you heard us, and you heard Mr. Jose Lopez in particular share various different opportunities and programs available through the Puerto Rican Cultural Center. That we want to invite you to learn more about these resources and share them with others. So in these slides will be shared, so you'll have access to these links for Vida Sida, El Rescate Transitional Living Program, Trans Chicago, and also Illinois Unidos, that provides various different resources related to COVID. Since we are still in a pandemic situation, you can find additional information and resources through there for access in terms of vaccination and testing and other resources. Now I'm going to turn it over to Monica Rodriguez, who's going to share some information about the All of Us research program. Monica?
Thank you, Lisa. For those of you who don't know, the All of Us research program is an NIH, or the National Institutes of Health study that is seeking to recruit 1 million or more participants to share their health data. We are part of the 21st Century Cures Act funding that falls under the Precision Medicine Initiative, which is the idea that we want to move away from what is a traditional cookie cutter size approach to healthcare and move towards an opportunity for individualized care. And we do that by looking at several different factors: lifestyle, education, and environment, and how those factors contribute to an individual's person's well-being or why they get sick. What this study is looking to do is to recruit folks to share their health data in the forms of surveys and biosamples. We ask for a blood and a urine sample. They can participate in this program completely in Spanish or completely in English. Everything is available. You can go over to joinallofus.org to participate. We currently have 5 main sites here in the city of Chicago through 5 of the leading institutions here. That includes the University of Illinois at Chicago, the University of Chicago North Shore, Rush, and Northwestern. Please feel free. I will drop my information in the chat if anyone has any questions or would like to learn more about this research program and how you can help change the face of health. I invite you to reach out. Yes, Simone, I will answer your question. Participation is limited to anyone who's 18 years old or up. It includes anyone who is living in the United States, so you do not have to have a citizenship status to participate. And lastly, we do not recruit anyone who is incarcerated. So those are kind of the 3 factors or criteria for participation.
Thank you, Monica. And now I'll turn it over to Xiomara Rodriguez, who is going to share some information about upcoming events and resources available through the Puerto Rican Cultural Center. Xiomara?
Hi. So yes, just some couple of upcoming events that we're having. Make sure everybody signs up for the nutrition classes for our spring series of nutrition classes by La Bodega del Barrio Food Bank. You can find more information on our Facebook page at the Puerto Rican Cultural Center or on Instagram at PRCC_CHGO. And then we also continue to have HIV, STI, and Hep C testing. And this flyer has all the information about if you would like to get some free testing. And yeah, those are our upcoming events. I hope that you all follow us on Instagram and Facebook to keep up to date with everything we have going on. Thank you.
Thank you so much, Xiomara. And next, we want to share, as you heard, this is a series for Wellness Wednesday, so we want to share some upcoming events. So I'm going to turn it over to Susana Gonzalez, who's going to share those events with you.
Thank you, Lisa. So obviously, since I work at ASI, I'm one of the nurse educators, and I'm so proud to support our CEO of ASI and Any Healthcare. It's a home care and home health agency, Dr. Marta Cerda, who is the CEO of the agency. She will be speaking next week, along with Dr. David Marquez And obviously one of the subjects is very dear to our hearts, and it's seniors, and I'm very inclusive of the home care, safety, and presence that we do in that community. So we're really looking forward to that. We also have some other upcoming events that we want you to look on social media and to follow the Twitter chats and to follow the Twitter links and to follow it on Instagram and on Facebook and share it with everyone. We have our infamous Marina del Rios. She's one of our wonderful physicians, and another physician, Geraldine Luna. And both physicians are very active with Illinois Unidos, which Dr. Aponte Soto and myself and Dr. Giacello and some amazing, phenomenal leaders are a part of. And we've been very focused on the COVID situation since April of last year. We've become quite stellar, respected colleagues in working in Illinois, focused on COVID-19 and prevention. So we want you to join us and share it with your friends and share it forward and forward, because this is really important. I am part of the Hispanic nurses at the national level and at the local level. I'm the past president for the chapter. So we look forward to always participating with NNLM and our wonderful Northwestern Precision Medicine and Monica and Darlene for all the greatness of the collaboration and true partnerships on what we could do when we collaborate together to serve. So we look forward to seeing you on all these webinars and informative sessions.
Thank you, Susana. So as you heard, we have 3 upcoming events these next 3 following Wednesdays in March. We are kicking off a conversation on recruitment and retention of older adults next week with Dr. Seda and Dr. Marquez, and then followed by a conversation on how to better engage our Latinx community in not just testing, but getting vaccinated as we all become prepared and our turn comes up. So we're going to have a Twitter chat conversation on the 24th about that with Drs. Del Rios and Dr. Luna. And then on March 31st, do you want to learn more about the resources of the National Network of the Library of Medicine? You can hear from Darlene Caskey, who you heard earlier today, about health literacy resources, as well as from Jacqueline Leskovic, who is going to share additional resources specific to the LGBTQIA community. So that's exciting because we can continue to build on today's conversation that day. And then we have the Puerto Rican Health Summit coming up on April 21st and 22nd as part of our partnership with the Puerto Rican Agenda. And again, a quick reminder to please complete the survey. The link is going to be dropped back in the chat again. So please go on the chat, grab that link and fill out that form. Tell us what you liked about today. What other sessions are you interested in? What are you hoping to have us talk about? If you have questions, suggestions, comment, also feel free to email us. You can either email us at info@tanomaconsulting.com, or you can email Jose Lopez at zenaida@prcc-chgo.org, or Dr. Omar Martinez Folledo at omar.martinez@temple.edu. If you'd like to reach me, my information is there as well. So feel free to connect with us. Please don't forget to check out the PRCC website as well for additional resources and information at prcc-chicago, CHGO, not Chicago completely, but just chgo.org. And lastly, we thank you for staying and bearing with us a few extra minutes. We realize we're a little bit over time, but we're really grateful for you to join us today. I want to echo the message of really what Jose Lopez said about embracing our differences and us learning about ourselves through our differences. A few years ago, when I was interning, I was volunteering at the Puerto Rican Cultural Center Vida Cida. I met a young woman named Julissa. She was identified as trans, but to me, it didn't matter. It was just her humanity, her level of respect and love that exuded out of her just to serve and just to be, just to be herself. That really touched me. And really took to heart for me the experience of trans people. I'm sorry, I'm getting a little emotional, but I wanted to dedicate this session today to Alexa Negron, who was murdered in Puerto Rico last year, last February. She was a 29-year-old transgender woman who lived in Puerto Rico. And like countless of others who have been persecuted for their gender identity, who have been rejected, abandoned, dehumanized, murdered. It's just for being who they are or being true to themselves. It is just unacceptable and inhumane. And I really urge everyone to really reflect on that deeply, to remember to treat others as you would like to be treated, with love and respect, and be kind and loving to one another. And it's just plain and simple, mi gente. Lean on love, compassion, and empathy. And together we can make a difference. Thank you. Muchísimas gracias, Mr. Jose Lopez. Again, you're always near and dear to my heart. From one delincuente, always here to serve. And Dr. Martinez, again, and all our invited guests, we really appreciate you joining today's conversation. We hope everyone considers reaching out and looking at the resources that are available through all of the programs that were shared today. Thank you, everyone. Peace and love.